Imagine being 9 years old and going to the doctor and you have no idea why. Your parents just drag you in there and come to find out you have diabetes. Diabetes is a difficult disease to learn to deal with when you're very young, and you also have to learn to do your blood sugar 3 to 4 times a day to monitor your levels. Diabetes is a metabolic disease in which the body has an inability to produce enough insulin to keep your blood sugars low, and it will cause them to raise. There's 2 different types of diabetes. The first one is type 1. That's usually from infant up until you're 30, and that one is where your body produces little to absolutely no insulin. Type 2 is for people in their 40s, or not 40s, excuse me, 40 and above, or people that are severely overweight. Their body still produces insulin, just not as enough of what they need. There's no answer as of right now what causes diabetes. The scientists don't believe that genes are the full reason, and they believe that the environment has something to do with it as well. But I can tell you as a diabetic that your life is turned upside down the second you find out you have diabetes. One of the most important things you have to do to keep yourself healthy is test your blood sugar. Blood sugar is also known as your glucose level. Everything we eat, like carbohydrates, for instance, pasta, breads, those have carbs in it, and that's what raises your blood sugar, but it also gives you the energy to be active throughout the day. The average blood sugar should be anywhere between 70 and 120. Any lower, and you have to feed yourself to correct it to get back to a normal level. Any higher, you would have to give yourself insulin to go back to a lower level to stable out. So the first thing I have to do in the morning when I wake up is I have to test my blood sugar. I have to test it every time I eat food, so like meals, snacks, and I also test it before I go to bed. There's a few different materials that you need to test your blood sugar. First, you need your glucose monitor. This is what actually reads the levels of the sugar in your blood. You also need your test strips. The test strip is what you put the blood on to put into the glucose meter to check your level. You need a lancet, and that's basically what pokes your finger. This little guy just helps poke your finger. And then you also need alcohol wipe. So the first thing you do when you are getting ready to test your blood sugar, you take a test strip out of the little vial and you place it with the strips down into the meter. Then as it comes on, a 25 will appear, and you have to wait for the little blinking light telling you to apply the blood. After that comes on, you want to make sure and change your lancet every time you do your blood sugar. So basically you just put in a new one, take off the cap, and that's a brand new lancet. From there, you'll pull back on it to load the lancet so that it can poke you. And then you'll take your alcohol swipe and you will clean off the area that you're going to use so that you have a clean reading. After you've done your alcohol wipe, you take the lancet and press it to your finger and push the button. From there, it's going to make you bleed, and you just need to milk the finger until you have enough blood to apply to the test strip. It then counts down, and it'll give you a reading. Mine's 174. It's a little high, but that's what you get when you have bronchitis. And so now you successfully know how to check your blood sugar. And it is a very much a different lifestyle as for a 9-year-old, but it takes a strong person to be diabetic, and I'm definitely that strong person.